help the services adapt and overcome. Thank you for being here today, and I thank you, Mr. Chairman.
I show 359,000 initial doses for service members. And then fully vaccinated, that means 2 shots, obviously, 147,000. I also have the civilian numbers and the contract numbers.
We believe that, of course, the vaccine is the right thing to do. It's clearly safe for service members, and we need to continue to educate our force and help them understand the benefits and ensure there's leadership involvement in the discussion of the benefits of the vaccine.
And then fully vaccinated, that means 2 shots, obviously, 140.
I think our initial look, and this is of course very early data, is acceptance rates are somewhere in the 2/3 territory, and of course it varies by different groups.
What about, are they deployable? If somebody who's not vaccinated, is that individual deployable?
The services and the commands have worked very hard over the last year to make sure that we can operate in a COVID environment. Before vaccines were available, the addition of the vaccine should make us more capable in that environment. But we've already demonstrated over the last year that we're fully capable of operating in a COVID environment.
Last June, we had over 120,000 service members.
The services have been very adaptive and resilient, that when larger formation exercises weren't possible, they've substituted those with some smaller formations that have allowed them to maintain their basic proficiency and currency and combat readiness. At the same time, of course, there is some quality lost in those larger formation training and exercises. But I would say the overall C ratings or readiness ratings for all the services and combatant commands have stayed within historic norms.
Thank you. Mr. Langevin.
We don't precisely know why an individual has not received a vaccine. We think it's important that the department continue to communicate to our service members the value of the vaccine, the safety of the vaccine, with continued leadership involvement to help our service members understand that.
House, what would be the force readiness impacts